You just enjoyed your most comfortable and energetic trimester, and now you're in the final countdown to meet your baby. As your prenatal appointment frequency increases and your baby's doing a lot of fine-tuning developmentally, you'll be feeling some changes as well. I'm Karen Ruby Brown, certified nurse midwife, and today we're discussing what to expect during your third trimester. This is Preggy Pals.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way.
Welcome to Preggy Pals, broadcasting from the Birth Education Center in San Diego. Preggy Pals is your online, on-the-go support group for expecting parents and those hoping to become pregnant. I'm your host, Stephanie Glover. Thanks to all of our loyal listeners who have joined the Preggy Pals Club. Our members get special episodes, bonus content after each new show, plus special giveaways and discounts. See our website for more information. Another way for you to stay connected is by downloading our free Preggy Pals app, available on the Android, iTunes, and Windows Marketplace. Sunny, our producer, is now going to give us some information about our virtual panelist program.
Yes, hello everybody. So if you are not located here in San Diego where we record, you can still participate in our shows. We would love for you to like our Facebook page for Preggy Pals. Also follow us on Twitter. If you're on Twitter, please use the hashtag PreggyPalsVP. That VP stands for virtual panelist. And I will be tweeting out some of the things we're talking about here in the studio. It gives you a great opportunity to join in on the conversation. You can ask our expert questions live if you happen to be following along, and we just want to share this experience with you, so be sure to check us out. And if you want more information about our virtual panelist program, you can visit our website at newmommymedia.com.
Great. Thank you, Sunny. So we're going to go around the table here and introduce our panelists, or rather have the panelists introduce themselves. So I'm going to go ahead and start with Sunny.
Yeah, I'll go ahead. I'm not pregnant, but I will say that I have 4 children. My oldest is 4, so I have a 4-year-old, a 2-year-old. Both of those are boys. And then I have identical twin girls, Ainsley and Addison, and those are my girls, and they are 10 months old now. Yeah.
Hi, my name is Willow Buckley, and I'm 35. Yeah, I turned 36 next week, sorry. I'm a labor doula and homeopathic practitioner, and I have 2 babies not pregnant at the moment. One is 1, and the other one is 3 years old. Older boy, younger girl.
Hi, my name is Michelle Ashley. I am 34. I'm an insurance agent. I am due on December 31st with my second son, and my oldest is about a year and a half. They'll be 20 months apart.
Great.
So you could have a New Year's baby.
Yes.
And make the news.
Well, thank you. Thanks for joining us.
All right, so before we get started with today's show, we are going to review an app. And this is actually focused on breastfeeding, but I know all of the mamas here in the studio have had babies before, so we are familiar with breastfeeding. This is actually called Mommy Log, and it's an app for the iPhone and iPad. And this is an app for either moms that exclusively pump or at least have pumping, somehow in their routine. It is a free app, which is one of the things I love about it because we have enough things to pay for as new moms. And this is a really simple way to basically keep track of how much you pumped and when you pumped. And if there are any notes that you want to include along with your pumping schedule, or anything that, happened that may be unusual, or anything you want to take note of. But it's a very simple app to operate. You can export all the information if it's something that you want to keep track of personally, or if you want to send it to your lactation consultant. And one of the things we just found on here that I really like is the idea of a timer. And at first I was like, I don't like to look at a clock when I'm breastfeeding. I just kind of like to, go with it. But for pumping, especially for those of you who are on a limited pump schedule, like you're at work work and you need to be, you just have a 15-minute break or something like that, it does have a section that you can record, and it actually gives you a countdown of how much time you have left. So anyways, wanted to kind of throw this out there to our panelists and to Stephanie to see what you guys thought of this app if you had a chance to test it. And if not, just speaking from experience in pumping prior, is this something you think you would use? So Stephanie, what do you think?
Actually, we were talking about how to use the timer, and I do agree with you now. I think that it is a good option if you are on a limited time and fitting it into a break. I was not a working mom, so I did not have to pump often, but I did take a class recently where I was pumping, and I did have to run into another room I only had 10 minutes at a time. So I could have definitely used this app to help with that.
Yeah, totally.
How about you guys?
Well, I think if I was pumping exclusively, I would probably use it more frequently, but the app itself is really simple and straightforward, which I like. But again, with pumping, I never got a lot out pumping with my first, so it actually was harder to track it because then I would be like,
you'd be sad.
I'd be sad and just like all that time, hardly anything. So I think if I were in a situation I had to pump exclusively, then I would definitely want to use something like it.
Yeah, I agree. I think if you're exclusively pumping, you're definitely going to have more of a use for it than those of us who are lucky enough to be at home more and not have to be on that rigid schedule of pumping. But I like the notes section because I notice when I do have to prep for a trip or something where I'm going to have to kind of like rack up a ton of milk, I like to know when I fed them last when I pumped, so I know, oh my gosh, I got 8 ounces just now, but that's also because I was gone for 10 hours. Or how did I get that much? Like to prep, like, oh, I know I could probably get 2 ounces, maybe 4, and that sounds like a very useful tool for those that aren't pumping as often.
Yeah, absolutely.
And as a midwife, Karen, would you recommend this to another mom? Or
I had my kids during the days of pen and paper.
What's that?
and I actually still have notes that I wrote. And they're kind of keepsakes now. So the first thing that occurred to me is that
You wouldn't have that
you wouldn't have
anymore.
that keepsake, but that's not what it's about. So I guess that's okay. For moms who are working, I think it could be really useful. And if babies are in the NICU,
Oh, yeah,
to be able
for
to
sure.
keep track. So for new moms who are just getting all this going, who don't have their babies attached to them, it could be really helpful. I absolutely see the value. I like the fact that it doesn't have a lot of bells and whistles because I think
It's more simple.
less is more,
Yeah, exactly.
except when it comes to milk.
That's right.
Usually more is more.
And there is a reason to cry over spilt milk in that case, too.
Liquid gold. Liquid gold.
So again, this is called Mommy Log. It is a free app for iPhone and iPad, and it sounds like we're all giving it a thumbs up, yeah?
yeah, thumbs up.
All right, thumbs up.
So today on Preggy Pals, we're continuing our series on fetal development, moving on to the 3rd trimester. Joining us today as our expert panelist is Karen Ruby Brown, a certified nurse midwife with extensive experience in a variety of birth settings, including hospital, birth center, and home. She received her midwifery training and Master's of Science in Nursing from Yale University in 2002, has been with UCSD Midwifery Service since 2003, and most recently opened a solo practice called Airy Midwifery, offering home and birth center deliveries. Thank you so much for joining us, Karen.
Thank you. Good to be here.
Great. So when we're talking about the 3rd trimester, what weeks of pregnancy correlate to the 3rd trimester?
So the 3rd trimester is the last third of pregnancy, and it's about 28 weeks to the time you deliver, which could be, I know you asked that question next. I'll let you ask that question.
Of course. Well, yeah, so I read that recently ACOG, which is the American College of Obstetrics and Gynecology, recently changed the definition of term from 37 weeks to 39 weeks. So, well, actually, I just answered that. But what would you find the range that's most common for full term in your practice? Like, what's the most common delivery week, I guess I would say? Or...
Yeah, most people are going to have their babies a week or two before or a week or two after their due dates. The due date is really just kind of our best guesstimation based on all the information we have, last period, any early ultrasounds, that sort of thing.
And why did they change it? Do you know, from 37 to 39 weeks?
A lot of you may have heard about the latest efforts to prevent early inductions to 39 weeks. So we're wanting to wait to 39 weeks now because we know that babies just do better. The longer they simmer inside, the better they do on the outside. So 39 weeks is what we consider the earliest appropriate time for what we call elective inductions, so inductions for no clinical reason. Honestly, you're probably better waiting until 40 or 41 weeks. 39 is the early, kind of that early border.
Okay.
That said, babies who are born at 37 weeks are considered technically full term, but they're early term.
Okay. Yeah, because I think I read somewhere too that it'll help with kind of the misdated due date too. If you kind of wait longer for induction, then you have less of a chance of premature delivery, correct?
Absolutely.
Okay. And so when we're talking about the baby's development, when do babies' lungs mature?
So lung development actually takes place from early pregnancy and continues to a couple years of life. So it's this whole continuum, and it can be broken down into bits and pieces, into specific phases. Basically, what happens is starting at about the 26th week of pregnancy, the lungs start to manufacture a chemical called surfactant. And surfactant allows for the exchange of gases. And that's what the lungs do, right? They exchange gases. And that process of producing surfactant continues. Like I said, through year 1, year 2, year 3, but the critical kind of transition happens at around 34 weeks. And so sometime after 34 weeks, most babies have enough surfactant that babies are going to do all right if they're born a little early. Even getting to 36 or 37, 36, 35 weeks, kind of those early, the late preterm babies, we call them now, can have a little bit of difficulty transitioning.
Okay.
So 34 weeks is kind of this magic line in the sand that is kind of, I suppose it's arguably arbitrary, but we have to choose these lines in the sand somewhere, right? And we find that most babies after 34 weeks can breathe okay on their own. Some can't, most can. And before 34 weeks, they have a higher risk of not being able to breathe on their own. So
and requiring being like on oxygen.
Various interventions to help them oxygenate. This goes into all the reasons why if someone has preterm labor, they might get some corticosteroid injections to help the baby's lung mature. So this goes into a whole branch of kind of perinatal science, but that's what's happening in the third trimester. Okay, and it's critical, of course, because that's the main transition that happens when the baby is born. They got to breathe.
I feel like it goes hand in hand sometimes when we're talking about term, is whether or not the baby's lungs are mature enough for the outside.
Exactly.
Right. And I wanted to ask our panelists, what week gestation were your kiddos born?
My son was 38 weeks.
Okay.
So he was just under 10 days, or just under 2 weeks. And so I was very lucky. My maternal side we're like faster cookers. So I was prepared to go to 43 weeks because I know that's just what happens. Mm-hmm. I didn't have to. He was ready. And then my daughter was 5 days before her due date, and I was annoyed because I had to wait longer than my son.
Right.
But with clients and everything else, I noticed that there's such I'm so over pregnancy, and it becomes such a personal thing instead of looking back at really what's the baby doing. So I think this panel right here and this information you're offering could really help those who are so like itching, that senioritis, I call it pregnancy-titis, right?
The home
they're just
stretch
done,
impatience.
right? Yeah,
Right.
They're so impatient, but that's such a personal thing, and to take them back out of the self and go back to really what is developing still, and what there's a reason why baby's not ready generally. So
yeah, I think my first was 35 weeks 4 days, or I'm sorry, 39 weeks 4 days, and then my second was 38 6. So kind of on
opposite,
yeah, a little bit earlier, but yeah, it's always interesting to see the broad range.
yeah.
So Karen, how does the baby's appearance change in the third trimester? You know, if we're thinking about, do they have hair? Are they still scrawny? You know, what are they looking like?
There's a ton of changes that happen. They're finessing their appearance in a lot of ways. They have hair called lanugo, which is that soft, downy, fuzzy hair that you can see, especially on darker skinned babies, like on their ears and their shoulders. They're so cute. And that tends to appear, when does that appear? It goes through different phases also. Lanugo has a history to it, but in the early third trimester, after 28 weeks, you're going to see it developing and it'll get thicker. And then it'll start kind of falling off towards the end of pregnancy. So the older a baby is in gestational age at birth, the less hairy and fuzzy they're going to be.
Okay.
Go hand in hand with the Lanugo is the vernix, which is that white cheesy substance. I describe it like the top of full-fat yogurt.
That's a great description.
Definitely. And what is the purpose of vernix?
The vernix is really fascinating. It has a lot of different purposes. It's an emollient, so it kind of protects the baby's skin as the baby's kind of steeping in a water bath for all that time. So it's a very emollient skin barrier. It's a biofilm, basically. It has please edit this out, microbial properties as well. It's a very complicated, complex, cool substance that for a long time used to be just wiped off at birth. Although back in the day before gloves, nurses used to rub it into their hands as hand lotion because it's the best. I mean, we should bottle this stuff, really.
Mm-hmm. It's funny that you say that because when I had my second, she was, good and cheesy, and my husband was holding her, and my doula was like, rub it in. Don't you think about, and so my husband's like, yes, taking direction. He was just rubbing it right in. She's like, that's good stuff. You can't get that anywhere else.
No, you can't.
There's no beauty supply store for that.
Right. They've actually tried to make synthetic versions, and they'll have, it's like making formula for breast milk. Right. It's going to have some of the properties, but it's not going to have all of the properties.
The magic. Yeah.
It's not going to have the magic. It's exactly right. It also helps the skin transition to extrauterine life. So if the baby's not bathed for the first week, it's going to help that baby transition. We think it also affects the microbiome. So there's a lot of good stuff to vernix.
Are babies' movements as jerky as they were in the second trimester in the third trimester?
In the third trimester, the babies kind of run out of space. They get a little straitjacketed. So rather than feeling karate kicks and punches, you're going to feel more wiggles and jiggles.
Okay. And weight-wise, where does the baby start out in the third trimester, and how much do they typically weigh at the end?
At the beginning of the third trimester, they're about 3 pounds, 2.5, 3 pounds. By the end, they can be anywhere from 6 to 9 pounds or more. They pack on about half a pound of fat a week.
Oh, wow.
Yeah.
Great. And when does the baby respond to outside sounds or light?
Oh, gosh. Early.
Oh, okay.
Yes.
So before the third trimester.
Yeah, if there's a door slam, you can feel the baby startle. So those reflexes are in play in the uterus.
Okay. When we come back, we'll discuss more fetal changes in the third trimester. We'll be right back. Welcome back. Today we're discussing fetal development in the third trimester. Certified nurse midwife Karen Ruby Brown is our expert. Okay, so when does baby typically assume his favorite position in utero?
Some babies assume a position really early on. They're little creatures of habit. They find their little corner and they just tuck themselves in, and they'll be head down from 20 weeks or whatever. Other babies are a little slower to follow the instructions of the universe, which are to commit, exactly. Clinically, we start paying attention fairly early. At 30 weeks is when we really start kind of documenting, okay, the baby's head down, the baby's not head down, the baby's sideways, the baby's this way, that way. Because remember, in the third trimester, baby's going to be packing on fat, right? So you want to allow them to get into a good optimal position for birth before they're too chunky to be able to
maneuver.
It gets to be they have as hard a time moving as we do when we're fully pregnant, where rolling over in bed is the big event. It's like, here we go,
right.
Rolling over now. So babies also just get very comfortable into certain positions. So for example, by 30 weeks, most babies are going to be head down. By 34 weeks, we start maybe having discussions with the baby about getting head down. And most of those babies still are going to be head down by 36 7 weeks.
Okay.
And if that's not the case, then we have other discussions on what we can do. There is a really great website called spinningbabies.com. I'm sure you all know about this. It's packed full of information. There's a lot of stuff in there, but if you can get into the spinning baby zone and spend some time with it, you can learn.
You just got to maneuver through, but it's filled with so much valuable information. Wonderful.
Yep. So by 34 weeks, most babes are going to be head down. Some are going to be stubborn.
Do you ever see in your practice the difference? Because I notice with second-time moms, because their uterus is now not like they say a pear, it's more like an apple or something. Like it's done it before.
Been through it.
That they are likely to have more of a chance of flipping later in gestation than they would a first time, which has that tighter uterus.
You mean flipping to breech or to just any kind of malposition?
Or back and forth, like, breech to not in the second baby or subsequent instead of the first.
Yeah, and it's not just the uterus, it's changed shape. The whole body changes shape, right? Once
Right.
you squeezed a human being into your body, all of the microarchitecture, the ligaments, the muscles, the
got
pelvis,
the memory,
everything.
Okay, good point.
But so they can flip more easily, but it also makes me less concerned as a midwife if I see a second-time mom or a third-time mom who has a posterior baby late in pregnancy. It just doesn't concern me as much because more likely the body's just going to help that baby pivot around.
Right. It's done it before instead of the first time, which is more lodged.
Yeah. But we do see moms who've had a bunch of babies who really don't have the muscle tone anymore. And those babies can get into all sorts of funky positions.
Right.
And how would you determine the baby's position? Is it something that you would need an ultrasound for, or can you tell with your hands?
A skilled clinician can tell with their hands, but we are sometimes faked out. So ultrasound can be helpful if your hands aren't giving you the feedback that you need. But it also has to do with how much amniotic fluid is in there. If you're like a tight water balloon, it's going to be hard to feel fetal parts. And in cases like that, ultrasound can be helpful. Now, I will say that all midwives have sometimes gotten faked out by frank breech babies feeling like they're head down.
Because of the bottom.
Yeah.
So you don't necessarily need an ultrasound to help figure out that position. If you're okay with a vaginal exam, at that point you can feel the head.
Oh, okay. And for the panelists, did anyone have any positional challenges with your babies late in pregnancy or in labor?
I guess I was a spoiled challenge because I did all my exercises, the spinning babies protocol, and I had a nice optimal fetal position, on the left, LOA. It was super nice. And I went to a late night movie the night before I went into labor. You never know when you're going to go.
Right.
Didn't do them, wasn't doing my exercises. And he ended up OP. So I had a little bit of back labor, which I'm actually thankful for. I got to experience it. So I know what it's like. 'Cause he turned pretty fast with some other things, but that was the most, which was very, like I said, it was a gift if that was the most I had to do.
Michelle, how about you?
No, he was always head down,
Compliant.
very active, but no, he I think he knew where he needed to be to get going.
He read the books.
He read the
For
books.
him. Let's hope she does too. Well, number 2, it's easier, right?
And it was interesting. I agree with the OP position because both of mine were OP presentation. We didn't realize with my first until I was already pushing for some time. And my second was OP over and over. And I was trying for a VBAC the second time around. But she told my body what to do when I was laboring, and I was hands and knees, and I was just following cues. And so she did turn, thankfully, at the last minute.
Yay,
but it's just funny. They're all different.
I'm just assuming the OP is what, sunny side up? Okay.
Yeah.
It's really fun.
He definitely was not.
And then,
the expression on your face, as you said, fun.
Well, having had an OP baby myself and having then attended women through OP labors, they're not fun.
No. Right. There's nothing beautiful about back labor in terms of when it's happening to you.
And when pregnancy comes to an end, we hear a lot about baby engaging or dropping. What does that mean?
So babies come down into the pelvis before they have to come down to come out, right? So the uterus kind of holds them kind of high in The uterus holds them a little high in the belly, but at the end of pregnancy, the pelvis relaxes a little bit, and the baby kind of twists and turns and spelunks a little lower into the pelvis, right? So the head gets engaged into that bony bowl of the pelvis. And what that means is that then there's more space up top. So you can maybe take a deeper breath. You can enjoy a full meal. Maybe you get some more heartburn because all of the soft tissue is loosening up and that sphincter can allow the gases to come through. So some women experience more heartburn at that point. And if you thought you were peeing a lot before,
Oh my gosh.
yeah, a head on your bladder will speak loudly.
Yes. I'm always curious because there's such a interesting camp on low amniotic fluid in women and what that means and what those numbers really are, and testing in the doctor's office versus the hospital, and then adding the position and the health of baby and the induction words start to come. Do you see, or do you have a number, or do you see there's ways to build it up, or?
The number has changed a little bit, especially the top value. We used to think of too much fluid as being around 20 centimeters, and that's a measurement on ultrasound.
Okay.
They're not cubic centimeters or milliliters. It's just a measurement. It's how we're able to do a vertical measurement on ultrasound. So that number is now 25. So again, these things there is subjectivity to all of this, right? Low fluid is considered to be less than 5 centimeters of fluid. Sometimes if moms hydrate really well, the baby will pee out more fluid, because that's all amniotic fluid is baby pee.
Recirculating.
Sometimes if there's a low number, it's because it's all in the kidneys and the baby they've swallowed it, it's in the kidneys, they need to pee. They pee, there's more fluid. So
it can vary within the week or
absolutely.
within a day.
It can vary from day to day, it can vary from hour to hour, really.
Wonderful. So could moms request another test?
Yeah, of course, it all depends on context, but in certain contexts, it would not be unreasonable to ask to drink a ton of fluid and then to retest. But that's something that it's all nuance, right? You need to talk about it with your healthcare provider, because it's not always the best idea.
No, definitely. I know it's all individual. There's so many different things around it. I'm always curious.
Yeah.
Well, thank you for joining us today, Karen. For more information about Karen Ruby Brown, as well as information about any of our panelists, you can visit the episode page on our website. This conversation continues for members of our Preggy Pals Club. After the show, Karen will discuss fetal changes in post-maturity, which is when the pregnancy continues beyond the average gestation. To join our club, visit newmommymedia.com.
Hi, Preggy Pals. We have a question for one of our experts. Joanna in Seattle writes, I'm interested in seeing a midwife for my next pregnancy, but I'm so confused by the alphabet soup behind all their names. CNM, CPM, LM, CM. What does that all mean?
Hi, this is Susan Melnico. I'm a certified nurse midwife, and I've been practicing for 30 years in home, birth center, and hospitals. And I wanted to answer your question about the alphabet soup behind the midwife's name. Yes, it is very confusing, but CNM stands for Certified Nurse Midwife. CPM stands for Certified Professional Midwife, and LM stands for Licensed Midwife. And the difference in the connotations is the type of training that a midwife has had. Certified nurse midwives are also registered nurses who go on for graduate training, usually through a university, and then get their master's degree and are termed certified nurse midwife. Certified professional midwives are usually apprenticeships with another home birth midwife, and they usually apprentice for 2 to 3 years with the midwife, learning one-on-one with them how to handle home births. And licensed midwives are licensed by the state that they work in, and usually have either gone to a training school or to an apprenticeship as well. Certified professional midwives are nationally certified, and licensed midwives are usually licensed by their state. And certified nurse midwives are also nationally certified. And each state has its own regulations governing how a midwife can practice. So it's important to know what your own state's regulations are.
This wraps up our show for today. We appreciate you all listening to Preggy Pals. Don't forget to check out our sister shows, Parent Savers, for parents with newborns, infants, and toddlers, Twin Talks for parents of multiples, and our show, The Boob Group, for moms who breastfeed their babies. This is Preggy Pals, your pregnancy, your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
New Mommy Media is expanding our lineup of shows for new and expecting parents. If you have an idea for a new series, or if you're a business or organization interested in joining our network of shows through a co-branded podcast, visit newmommymedia.com. Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.